the size of your basket with everyday low prices and a full range of back to school essentials. And guess what? They're all in one place. So how about we make the season a breeze? You turn it into the hero that they see you as, for walking with them every step of the way in their educational journey. So let's do that with Naivas as we go back to school. All right. Like I said, Healthy Friday conversation. We're having it around the precision in cancer imaging, what we're now able to see in terms of cancer causing, what we're now able to see in terms of cancer treatment, cure and care. And joining us in the hot seats of the Situation Room this morning, we have two guests. Dr. KG Kalur is the Director of Molecular Imaging at Healthcare Global Enterprises, and Diane Morioki is a nuclear medicine technologist. Good morning to both of you.
Good morning.
Good morning.
Karibu Sana to the hot seats of the Situation Room. We are going to get into this this morning, and we'll talk about Dr. Kalur. So we'll get into some of this as we have this conversation. But before that, we're going to welcome you to the Situation Room in true Situation Room style. Mark Bichachi has a proverb from Mozambique that he's going to share with you, and then we would like to get your interpretation of this proverb. All right?
Well, it's a good thing that we have people who've studied biology at some level, because this includes biological entities. So, did you know, if you fail to be a lizard in your own land, you will also fail to be a crocodile in another land?
No, I could not understand.
Okay.
Let's try again.
Let us try again.
Yes.
If you fail
Yes.
to be a lizard in
Yes.
your own land,
Yes.
you will also fail to be a crocodile in another land.
Yes.
Mm.
Okay. Now you are. What context I understand here is what we do in our center in our country, and how we have been successful there, and what we are going to do here in your country. And we want to be very helpful for your patients. Okay. And why we are here. Okay. We are doing precision oncology nowadays. Okay. And it needs a precision diagnosis also. You have to be very, very accurate. Gone are the days when you are doing only CT scan or MRI scan or ultrasound scan. It will not give you all the information what you want. Okay. That is when the new technology has come. And
So before we get into the technology,
yes.
Daktari,
Yeah.
so essentially you're saying that
Yeah.
from the proverb
Yes.
that you've done it somewhere, and
Yes.
you're going to be able to do it somewhere, but you
Yes.
have to have started somewhere.
He's saying
Okay.
he's been a crocodile for a while. He's now a crocodile importer.
okay. It
How about
may be a bit difficult to understand your local crowds here. Whatever little I could understand, I'm telling what I was doing there. So I was a lizard there, okay?
Yes.
And we have grown up because everybody has to start somewhere.
Absolutely.
So today we are the largest cancer care providers in India. Okay. And we are a single specialty.
I like your
Yes.
ability
Yes.
to turn the proverb
Yes.
and personalize it. It's
Yeah.
quite a unique skill. But now we need to test your
Yes.
friend.
Yeah.
Who
Let's hear from you, Diane.
Yes,
That's what your interpretation is.
Diane, who keeps scans as pets. So please.
All right. So you can be a lizard in your country,
In your
and a
land, yes.
crocodile in another
Yes.
one. So what I understand from that is, if you're not being something where you're at the moment, you can't expect when you go to somewhere else you're going to be either bigger or greater than whatever you started doing when you were starting. So you have to start from somewhere. Maybe be that lizard in your country, and you'll grow to something bigger. And then maybe when you go elsewhere, you can even fly higher, broader than that, give more.
And
There you go.
I ask myself, the people who are applying for green cards and things like that, as you go to another land, are you going as a lizard or a crocodile?
Okay. Well, so let's get into it this morning. And as we talk about cancer,
Yeah.
looking at a disease that in the last 30 years has really affected many, many people, not just those who are sick, but those who have to care for them in terms of family, and then those who have to then offer treatment and care, medical professionals across board. We've seen a deepening of the effect of this disease, and being able to find it continues to be an issue. That there's somebody who turned up with a flu. It's just the right example that I need to give since I have a flu, but okay. Somebody who turned up with a flu and has been going back and forth, and they made the wrong diagnosis and then ended up later with esophageal cancer. So in terms of diagnosis, this is right where this conversation lies. Because in terms of what the technology then has been able to do over the last few years, then it's pretty interesting. So give us a walkthrough about, Healthcare Global Enterprises and what it is that you've been able to do in terms of finding cancer, essentially, quite simply.
You see, every business or a hospital has a small beginning. We were about 25 years ago. We were only one small hospital in India. It was started by a group of doctors. Even in India, those days, cancer care or health care was limited only to few government hospitals, but it was not meeting the needs or requirements of the people there. So only few government hospitals were not able to cater to our population is huge. We are the most populous country in the world today. So then we, group of doctors started that venture and then started at a small setup. We have grown now and we have 25 centers across India, and we cater to only cancer because most of the hospitals you can see some space is allocated. Okay, this is a cancer wing in a big hospital. It is not so nowadays. Okay, because cancer it needs a lot of investment, lot of specialists are there. Technology has improved. You have to deal with the cancer in a different manner, and that is why our core competency is only cancer care, and we stick to only cancer specialty. So wherever, even in India, we have gone to tier 2, tier 3 cities. Why we are moving peripherally? Everybody will flock to the cities, but there are a lot of people who cannot afford to come to a big cities. Money matters. So we are going to their doorsteps. Then my colleague was asking, what made you come to Kenya? And we were in there, we were getting a lot of patients from Kenya. Then we went through, we know when the patient moves from one country to another country, how much struggle they have to do. Money matters, expenditure, not only that patient, anxiety will be there. And they have to come along with their another relative, expenditure is more. And they have to spend 1 month or 2 months there. And looking at that, we thought that why not again? We are successful in India, going to the periphery, and we are treating a lot of patients from Kenya. They were coming to us, and they were getting lost. India is a huge country, where to go? So they were getting lost. So we thought that okay, we had some friends here, colleagues here. We wanted to join hands, and they raised it, and then that is how a beginning started here, and we have started one center here.
Okay, so there is now the aspect of the technology now getting into Kenya, and that is working, and that is where Diana now as the resident who's doing that here. And one would want to ask, because he's talking about like better as a CT, and still even when you come into this studio we have CT Muga. So one perhaps
what is this CT?
Perhaps what is PET CT scan, and how critical is it when it comes to the management, diagnosis, and treating of cancer?
So, hi. Thank you for having me. I'm Diane Muriuki. I am a nuclear medicine technologist. When I say a nuclear medicine technologist, it's just like an exaggerated way of saying we can get to see what is happening in a person's body by giving something we call a radio tracer. A radio tracer helps us see what is happening in a patient's body. If there's cancer, we'll be able to pick it. If there's spread of cancer, we also see it. And that's through now the help of the PET. The PET, now you're saying the PET we keep, the PET CT we keep. A PET means positron emission tomography, CT scan. Positron emission tomography is when whatever we are injecting to a patient, which is a radio tracer, is a radioactive substance. That radioactive substance merges with the electrons in the patient's body, and through that something happens which is called annihilation. Annihilation is where this positron is being emitted, and from maybe the cancerous cells in the patient's body, we are able to pick whatever uptakes more. With that one, it's super easy to make diagnosis because it's an overview of what is happening in the patient's body. And with the help of now our PET CT scanner, which has a PET side and a CT side, because I'm sure maybe most of you have heard about the CT, the normal CT, which now contradicts the PET, because in normal CT, the CT does conventional imaging where the CT itself is emitting the radiation. But now in PET, it's vice versa, of that the patient is the one who does the emission of the radiation. And through now this positron emission tomography CT scanner, whatever the patient is emitting is picked, and through that we see images which help us see the functions of the organs in the patient's body, where the likes of Dr. Kalur can be able to make like diagnosis and even plan for treatment of this cancer.
You know, I am intrigued as someone who went for a test called metamephrine, and then I was told that that is an indicator of cancer. So I started praying in tongues, and then the next day they did a CT scan, and then there was nothing, and it's all confusing as a journey for a lot of people, because the like Ndu said, you know, you go in for a flu, then you come out that your pancreas is at stage 4. You know, so the technology you're talking about and the center you're talking about, how much more simpler for the common person is it for them now to be able to be properly diagnosed? Because my test said I have cancer, my scan said I don't have cancer, and my faith says I don't have cancer. So how do I know for sure?
So coming to your question, so this is the diagnostic dilemma for most of the patients. PET CT is a highly specialized investigation. You have a CT. CT is for form imaging. CT, MR, ultrasound, they will see the structure. Okay. For example, there are some lymph nodes here and there. But the CT and MRI will only tell, yes, there is a lymph node there. Okay. But is it cancerous or not? It will be difficult for them. Okay. When there is a high index of suspicion for a cancer, we use the specialized, these tracers. When we inject, they are taken up by these fellows, the cancerous tumor or the lymph node or wherever it is in the body. What happens in most of the clinical practice, for example, a woman comes with a breast lump. Usually what were they doing earlier? Just a mammogram, okay, there is a lump there, take out, do a biopsy. But today, science says that if it is more than 2 centimeters, consider that it is a systemic disease, already it has spread.
2 centimeters.
More than 2 centimeters. Okay. It can be. Okay. Even if it is less than 2 centimeters also, some patients, it can be very aggressive and it has spread elsewhere.
Sorry. Is this before testing, Dr.
Before testing. I'm giving you just a generalized statement. Okay. I'm not going by only the size or anything.
All right.
So here there is a unmet need. Okay. We want to be very precise. We want to know what stage patient has. Because patient needs accurate diagnosis, and based on that accurate diagnosis, you can have excellent treatment options now. When I was doing oncology, I'm telling you about 20-25 years ago, if a patient comes with a lung cancer, we used to tell, okay, your life, write a will, 15 months maximum, you will live. Okay. Now we see 5 years, 10 years with advanced cancers. Why? Because the technology has improved, diagnosis has improved, diagnostic accuracy has improved, PET scan has made a lot of difference, and based on that, your treatment modalities have changed. Okay, and this is how we are able to do. And when we give this, as my technologist told, that they're small tracers. And usually there is a lot of apprehension also. Hey, you are injecting radioactivity into my body. What will happen? Okay, so will it cause any radiation to me? So it is nothing like that. The amount of radiation the patient gets by the radio tracer injection is on an average, thumb rule is 1/10 of what the patient gets by CT scan. So you need not worry about any radiation hazard. Okay. So when we combine both PET CT and CT together, the patient will get some radiation, but there is within the acceptable limit. It is not going to harm. But radiation coming to the patient For a cancer patient, from a diagnosis is immaterial because the what you can say, risk versus benefit. Benefits far outweigh the risks. Okay, so you need not worry about the general public, lay public should not be worried. Hey, I am going to undergo CT scan, PET scan, lot of radiation will happen, nothing will happen. So nothing to worry about it. So we are able to diagnose today smallest lesions. Okay, and okay, diagnosis is done. We know the staging now. What happens in any patient earlier? What they were doing? Suppose, for example, I was giving you a breast example, one lump. They were doing just a chest X-ray or a CT scan of the chest or mammogram, and be done with it. Okay, go ahead. What is happening to lungs? Has it spread to the lungs? Has it gone to the bones? Has it gone anywhere else in the body? Okay, it was not possible. So with the PET scan, we are doing from head to foot. So we cover everything. One simple algorithm I will tell you. For breast example, how they were doing the different types of a PET scan before coming to staging. Okay, we want to proper staging. Mammogram. Suppose the lump is on the left breast, so do a mammogram on the right side. It may be on the right side also. Then has it gone to the lung? So do a CT scan of the lung. Has it gone to the bones? Because patient may complain some vague pain in the bones here. Do a bone scan. Then if patient has some neurological deficit, say some headache or something, has it gone to the brain also? Do a MRI scan of the brain. So patient will go from pillar to post for almost 1 week from running for all these diagnostic things. Now it is not there. 20 minutes, everything done from head to foot. You will have answers. All these answers are there in 20 minutes flat. And accuracy far higher than CT and MRI. Okay, MRI is required. I am not telling that they are not at all required. And CT will give a structural information about where is the problem, where it is located. PET gives physiological information because the physiology always precedes morphology. Okay, because your chemistry inside, what you can say, we are basically studying in vivo chemistry. Chemistry is always the first one to become abnormal. Metabolism is changing, those cells are behaving abnormal. There are no structural changes still. Okay, suddenly the lesions will not become 5 centimeter, 2 centimeter like that. It takes time. Okay, so whereas PET is able to identify, look here, something is going wrong. Your structural changes may not be there still. So it will caution us. So we will be able to diagnose, identify the problem. Because we are doing whole body, it will avoid many unnecessary tests.
This is intriguing, Doc. And I'm curious,
yes,
in the Kenyan situation,
yes,
how is it going to be different? One,
yes,
and then two, are you saying that now instead of doing all those tests,
yes,
I should just appear once a year and get a PET scan and go home knowing that I'm okay?
Okay, you have gone to an extreme, okay, because these PET scans are expensive. It has to be judiciously used, okay. It has to be decided by the doctor, okay. He will decide, okay. He will decide that whether doing this particular test is justified or not. Because it is expensive test, you have to pay for that.
You know, expensive is relative, and money is not a problem.
Okay,
you know.
if money is not,
I do tell you that my claims as per yesterday are in the billions. So I just want to hear this practically. And perhaps let me involve the nuclear PET scan expert.
Can Daktari finish that point that he was making about,
yes,
the immediacy, if not the immediacy?
For the?
What you were talking about is not something that you would just come in and see and go, but that there's a process, isn't it?
You can just come in for a PET scan.
And then
you can do a PET scan and do whole body scan is done, and whole thing is evaluated. We'll identify the problem. Okay. So there are many patients even in our country, they want, it has become quite popular now. They want to have, let me get it done. You can get it done, but most of the time, you see, there are certain guidelines. Even when any medicine is practiced, there are guidelines. It cannot be just utilized just like that. It is there. Okay. So if a person has money, okay, I don't mind if he wants to shell out money, we can do it. But it is not justified to do just like that. And one thing I can tell you is you are going to avoid many unnecessary procedures. One example I will give you. For example, let us come to a breast cancer patient only. There is a lump. And you have done the scan, but there is already metastatic. Already it has spread all over the body. Now, otherwise, but for this, the patient would have undergone some surgery. It was unnecessary. Because already it has spread elsewhere. The patient goes directly for some other treatment, chemotherapy. Okay? And another example, let us say colon cancer. Okay? So colon cancer, it may be very tiny lesion, but it has shown metastasis elsewhere in the body. Patient does not have any symptom on the colon. Okay? There is no point in doing a surgery for that. Patient will directly go to some other treatment. Otherwise, so we have avoided one major surgery, associated problems with the surgery, the cost involved in the surgery, and you are starting the particular treatment very early so that the patient will benefit. So it is known, a PET scan is known to upgrade the disease at least in about 30 to 40% of the cases. You think it is stage 1, it may be stage 4.
Okay. So Diana,
so it makes a difference.
Yeah. Dr. has talked in terms of initially when you would go in for several tests for us to know what exactly is happening. But here we now come with a new technology that fastens these things, and in 20 seconds you already have an idea of what is wrong. So in terms of you as a technician who always works, who's always doing this test, how has that improved cases in terms of immediacy in dealing with patients, and as well as just cut the numbers in terms of patients in your station looking for these services? Because now we're talking about a week, but now I can get in 20 minutes and I'm out. How's just changed the game in your sector?
This has really changed it because for one, our institution, which I don't know if I mentioned, HCG Cancer Care, we are the first one to introduce a new tracer. It's called Gallium-68. It has a few tracers. There's FAPI, there's PSMA, and there's DOTA. For FAPI, we do general oncology cases. We can get to examine if somebody has been sent in, maybe the primary for breast, for colon, we can get to do FAPI scans to see what's the extent of the cancer. And when we are doing these scans, we are not only like looking at the extent, they can be newly diagnosed cases. And there's something you've asked, which I would like to clarify. You can't just come in for a PET scan. You need to have a request form, because PET scan, unlike maybe an ultrasound or a mammo, PET scan is not a screening exam. So you have to have like a certain baseline for you to come in for a PET scan first. But instead of like going through all, like Doc has said, go for a CT scan, maybe for your brain, go for a mammogram, then go for a chest abdominal pelvic CT scan, you have the advantage of doing a PET scan, which you'll do one scan, vertex to toes, and we'll get to see what's happening in your body. So with these FAPI scans, again, which is very, very advantageous to the patient, because unlike in the previous exams which have been happening in the country, which are FTG based, where they have maybe to fast for hours before they come in for the scan, they have to have a very long waiting time before they are maybe booked for a scan. For our facility, there's no like any major preparations needed before you come in for the scan. You can just like fast for 2 hours before the scan for FAPI scans, and we get to do the scan for you, and we'll get to examine what is happening in your body. For PSMA scans, you don't even have to have any preparation. Just walk in for the scan. There's no waiting time, because I understand most facilities you have to like wait for 2 months, 3 months. Here you just come in, you'll have your scan done. For the one which is really making it outstand in the country and even in Africa as a continent is the DOTA scan. Not many countries in Africa are doing a DOTA scan. For patients who have neuroendocrine tumors, these are tumors which are tapped up from the neuroendocrine system.
Where is that?
in your body. There's a
the endocrine system is internal medicine. It is
I
your
understand,
glands. It is your yes.
You've combined it with neuro, though.
Yeah, neuro. It's an NET, a neuroendocrine tumor. You have cells in the body, and they can be neuroendocrine related to cause a certain cancer. The way you will have maybe a breast cancer, you'll have some which are neuroendocrine based, and for that you can't do like the FDG scan or the FAPI scan. For that specific scan to see where there's metastasis for better precision and see the precise of the extent of this cancer, we have the daughter scan, which helps us see where is this cancer really coming from and where has it moved to.
Okay.
So with
so for purposes of definition, for many who may have never heard this word, metastasized, the S and the T's always do the thing. Just give us a quick description of what that actually means and what we are looking for.
So metastasis is just explaining the spread of cancer. Instead of saying spread of cancer, we say metastasis. In the layman's language, it's just the spread of cancer. Yeah,
Okay.
And that's another important thing which PET is helping us do, because we can get to see where the cancer has spread by just doing that PET scan, which is helping a lot of people instead of traveling all the way to India, maybe the UK, to go have this PET scan done, especially for the daughter one. I'll emphasize on that because there's nobody else doing it. We are the ones doing it, and it's really, really helping a lot of patients, and it's easy. They are getting onto treatment, and I'm sure the treatment is helping them move along.
Okay.
You both said that you can't just walk in for a PET scan. Now I'm thinking I am going to hospital A. I am seeing Dr. D, and they're giving me the traditional pathways, CT scan, etc. How do we get to you? Are you referable to? Do you take insurance? Can I tell my doctor specifically I'd like to go to this place? And this place, where is it?
Okay. HCG is located in Shivaji Road. It's next to MP Shah in Parklands. Most people haven't heard of it, but it's just there. We are a small hospital, but we are serving a lot of patients, and we are doing a very amazing job. We take referrals. Most referrals come from within Nairobi, outside Nairobi, and even outside of Kenya. We've been seeing a lot of international patients, and based that it's a cancer center, purely doing cancer cases, we get a lot of cases even from like international referrals, because there's a lot of treatment going on there. Other than the PET side, which just started, though it's been there for 15 years, and they have been doing treatment with their Electa machine, where they get to do SBRT treatment, IGRT treatment. Sorry. And they also do brachytherapy, which is like super essential for patients who have the endometrium cancer. They are doing treatment for that. For prostate, they are doing, I think, the SPRT, right, Doc? Yeah, the SPRT treatment. So it's not just the diagnosis part of it. I'd like to believe that our facility has become like one African medical tourism hub, where when you come to our facility, you can get to see an oncologist for consultation. They can get to refer you for a PET scan for diagnosis, and when you take back the report, they'll get even to take you in for treatment. They'll plan the treatment, and you'll still have the treatment done at our facility. It's in Shivaji Road, next to MP Shah.
Okay. We're going to. I want to take a break, and then we'll come back and look at then. Okay, so then what happens? Because we could have an idea about, and I'm glad that you went to that direction, because then we see that beyond the diagnosis, then there are then pathways towards treatment, and we'll get into that in just a bit. Dr. K.G. Kalur and Diane Morioki are here with us this morning. It's a Healthy Friday conversation, and we're looking at, more succinct, more precise imaging when it comes to cancer that could actually revolutionize what is happening with the treatment of this disease that has essentially taken lots of folks by storm. We're going to take a break at this point. It's 24 minutes to 8 o'clock. We'll come back and continue with this. And I know there will be questions, and we'll get into those when we come back. Good morning.
This is the Situation Room, the only way to start your day.
The fun never stops on Star Times this Easter.
Unveiling Kenya's finest travel gems all in one place. From luxurious hotels to hidden dining treasures, Msafiri.ke is your ultimate gateway to the best of Kenya. Explore breathtaking destinations and must-visit spots effortlessly. Browse, book, and experience the heart of Kenyan hospitality with just a tap. Dive into Msafiri.ke now. Log in, secure your dream getaway, or call 0719 012 561 today.
In a city of passing lights, some people are just meant to be. It's how we fall in love and keep on chasing on the edge of destiny. We grew up into different worlds, but now we share one dream. Everything changes, we never change. Tomorrow is promised. Let's go home for you and me.
We value your feedback and welcome your comments, queries, and complaints regarding our content. You can get in touch with us via SMS on 22151. Call 0719-012450 or 0719-012090 or email feedback@standardmedia.co.ke. Our PO Box number is 30080-00100, Nairobi, or deliver it to our offices at Standard Group Center, Mombasa Road, Nairobi.
Cherry, marry me. Please be with me for the rest of my life.
Yes, Paco. Yes, I will marry you.
Cherry Red? I'm Dave's girlfriend, Becca.
I just hope that this wedding pushes through without a hitch.
Come back here to get in the way of their wedding, Dad.
Well, then promise me that Drew won't cause us any trouble either. The last thing we need is him revealing what happened in the past.
Dental Tips brought to you by Sensodyne. The Gentle Touch. Did you know brushing too hard can damage your enamel and cause tooth sensitivity? Use a soft bristle toothbrush and Sensodyne toothpaste for daily repair and long-lasting protection.
Sensodyne gives you long-lasting protections against sensitivity. And people come in and they're like, oh, it works. I can have ice cream and I'm not in any discomfort. I recommend Sensodyne because it works. It's brilliant.
Can show there is a mass there, but we want to know what it is. Biopsy has to be done, or there is a high index of suspicion because it is flagged as, okay, there is some tumor there, likely to be cancer or malignant. So the next question is, okay, if it is malignant, how to deal with this? What we have to do next? So whenever there is malignancy, the treating doctor wants a biopsy information. And he also wants to know, is it localized, only that place, or it has spread elsewhere? So this is where the PET will help, which has revolutionized. I can say the PET has revolutionized the way we are doing oncology imaging today, and also oncology treatment is heavily dependent upon this PET scan because the amount of information, CT and PET, here 1 + 1 is not 2. The amount of information coming out from both PET and CT together is phenomenal. It is exponential. Okay, so that extra information is helping the patients to undergo better treatment. And suppose there is a lesion there. Now we want to do a biopsy. Okay, and PET will tell if you put in particular needle in this particular area, your chances of getting a successful biopsy report is high. Earlier they were using mass that just blindly put a needle and do it. It was not giving, say, a good pathological information because it was coming as a blood or necrosis. Whereas when we add PET, PET will always identify where the tumor is growing. So you put the needle where it is creating a problem for the patient. So you take out the sample from there, subject it to pathology and do it. So PET is also helping to do a better biopsy. Next, now PET is also helping to do better radiotherapy. Okay, so today it is, earlier it was only CT based radiotherapy planning. Now if you add PET information, PET will always find something extra here and there. Now, based on the CT scan, your field was, okay, let us say 10 by 10 centimeter to give radiotherapy. Now, beyond the 10 centimeter, there is another fellow lurking there, which was not identified in the CT. So, it is identified in the PET. In the same go, you are treating in the same time that area also. So, you are giving better chance of treatment success and better survival rate. So, because when you are seeing the whole body, that picture changes totally. It is not, when we do a cancer imaging now, it is not only regional. You have to do whole body. So that is one which is helping a lot. And next, it is also helping surgeons to do better surgery now. Okay. So it has affected almost all fields, say biopsy, radiotherapy, and planning of radiotherapy and the surgery. And there are PET-directed surgeries now. There are small probes are given to the patient, to the doctor, inject it. Patient will go to the OT. It may be very tiny, and the probes will detect radiation. Okay, so the surgeon may be finding it very difficult. I am seeing in the machine, but it may be very difficult for him to see on the OT bed. No, a lot of blood, everything there. They just hold the probe there. It will make a lot of noise. Take out that. So surgery by noise, not by.
You know, it's amazing.
Yes,
and I'm so glad to hear this. When we talk about after the analysis, she had mentioned that there's oncologists and things like that.
Yeah.
So what kind of care, if in the unfortunate event the tests are positive and we need to have surgery by ear, as you call it, what extent of services post diagnosis are you offering? And how different is it from making it unnecessary for me to go to India?
That is why we are precisely here. I am very happy to say, and I used to feel bad for the patients who are traveling 6 hours, 10 hours, come there with all the misery, pain and all. Today we have brought that technology to your doorstep. Today we can proudly say that we do different types of PET scans. We do around 12 different types of PET scans. Most of the centers in the world do only one, what is called as the FDG PET scan, for which you need a nuclear reactor, cyclotron. Okay, so it is a huge amount of investment. You need a lot of people, expenditure. Why PET scan was expensive was because of that also. Now with the advent of new technology, it has changed. We don't need a cyclotron anymore for diagnosing 90% of your day-to-day, our clinical practice. Okay, and most of the centers, they do only one PET scan called FDG, fluorodeoxyglucose, because glucose is required for us. We have eat, energy is required, and cancer cells need more energy. I'm telling in very simple manner. So they need more energy because they are rapidly progressing, dividing. So whatever that radioactive glucose we give, the cancer cells will take up those cells more, and they become evident in the PET scan. But that is not the only answer now, because different cancers have different needs. They need different food to survive and propagate. The science has identified all those things now. And for different cancers, we are using different PET scans, because we know this particular, she told about a DOTA scan. It's a neuroendocrine tumor, for which there is something called a somatostatin receptor expression. We have certain molecule there which will go identify that. It will go only there, nowhere else. So your diagnosis is much more precise. Okay, and FAPI is one which is it has become quite popular, because you don't need to fast like when you do a PET scan. Walk in, walk out, and uptake into the tumor is so fast. With radioactive glucose, you have to wait for 1 hour. Here, you can start doing the scan within 20-30 minutes after giving injection. Isotope injected is less. Radiation burden to the patient is less. The amount of information FAPI is giving is much more than the conventional FDG PET scan done anywhere in the world, even in your country. Now we have brought different type of tracers. We are currently doing 4 PET scans. We are just evaluating. Slowly, we are adding another 7 to 8 different type of PET scans, which your patients are getting here. Some of these things are still not done in Europe and USA.
Okay.
Because I am heavily into, our center is heavily into research, all those things. We bring the new technology for the betterment of the patient. New science. The same thing we are promising to our Kenyan friends here, that whatever is being done in India is being done right now in your country.
All right.
So all these advanced PET scans, many of the centers, they don't do at all. Even in the advanced countries or advanced centers, that is right now happening in your country. They are getting cutting edge diagnostic information that will definitely help your patients to have a better treatment.
Okay. So Diana, there is the aspect of the PET scans now being in the country. Kenyans do not travel to India. But even when Kenyans are in the country, how affordable is the treatment? And I remember earlier, Mark had asked in terms of insurance, do you uptake insurance? And even when we talk about cutting the cost, because now we're talking about not doing close to 10 tests, we're only doing one. You don't have to travel to India, you're now in the country. So in terms of Kenyans not going there, what do the numbers look like for you? And in terms of cost, what are we looking at?
In terms of cost, for the patient is very much cost efficient because SHA, which is, I believe every person nowadays has it, which is the government endorsed, is covering for that exam. It covers. And insurances, we are open to Jubilee, AR, almost all insurance, we are taking that, and the cost is being covered by the insurances and the SHA. So that makes it very easy for the patient, and for the aspect of them not having to travel all the way to India to go have the scan, all that struggle and the sadness and the family, the provision and all, is making it very, very easy for the patient.
Okay.
So,
so Diane, do we find that this test is the reason why a lot of people are traveling to India in the first place?
Yes, because you'll find most people earlier on, the scan wasn't locally available, but now we have it locally available. They can just come have it, and very soon, I'm sure, with the direction we are taking, we'll even start the diagnostics, which will be like a total hub for everything. You'll have your scan, we'll have your treatment, and everything will be sorted. But as of now, we are having the we are having the local treatment, the radiation, the surgery, the chemo, everything is there. Yeah, so there's no need for the patient to travel. Anymore.
And if I'm paying out of pocket, what are we looking at?
It's very, very much affordable. Yes.
Affordable is relative.
Compared to them traveling all the way and having all the things they'll have to settle, maybe go book for the hospital, the hotels to stay in. When you just come have it here, it's very affordable for the patient to manage. And having the SHA covering,
of course, it's a big deal. I'm trying to liken this to the test we would normally have. That, nowadays we are saying everybody go in for a test. Men go in for, your test. Women go in for your pap smear, go in for your breast exam. Do your breast exam yourself. This is not the test, and I can wake up today and I can go and ask for a pap smear to be done. I'll get one done.
Yes.
Right? Or I can go and ask that. But for this, what you're saying is that I have to have a referral for me to come and have the test done?
Yes, you need to have a request form from a doctor for you to do the scan. You can't just walk in because it's not a screening method.
It's not screening?
Yes. Yes.
Okay. So there must have been a pre-diagnosis of cancer for you to get this?
No, nothing like that. You see, for example, as I'm a doctor, a lady walks in. My clinical examination knows that, frankly, she has a breast cancer. The first investigation, at least done in our center in India, is straight away PET scan, because it will cut down many unnecessary investigations. By end of the day, you have all the diagnosis done, and the mandate given to me is, if the patient does not have a biopsy report, it is my responsibility to take out best possible site to do the biopsy. Within 2 days, you have the biopsy report also ready. By within 1 week, your treatment will start. Okay. So if a clinician has a high index of suspicion that, this patient has a cancer, he can straight away do the PET scan. Otherwise, what is happening most of the places, even in India, including here, they usually go to, the facility may not be available, nearest available. Here, that center may be far off, maybe 300, 400 kilometers from here. He may be trying to do locally whatever ultrasound or a CT scan. That radiologist or local specialist will tell, okay, this is the tumor you have. Then you want to do anything further, better do a PET scan upfront. That will, in my practice, it will save lots and lots of unnecessary procedures, and money it saved a lot.
Are we seeing, I mean, and obviously this is a technology, and you tell us about it's being launched today, this machine that you give us a little bit of information about that. But are we seeing that as a result of this PET CT, that folks are getting treated with better results? Are we seeing that as a result of this precision testing, that treatment and the care thereafter can then be targeted and folks are coming out? Are we seeing that?
Yes.
Okay. Maybe both of you can go into that.
I'll tell you, the treatment has dramatically changed. PET CT is the single most important, you can say, the investigation of this millennium or this century, which has changed the way we are treating the cancer patients. They are having better diagnosis, earlier treatment, better outcomes. That is foregone conclusion. Everyone has understood that. Next, coming to very precise treatment. Can this particular ligand, or what you can say tracer, we are using it to pinpoint, with a pinpoint accuracy, where is the tumor. Okay. Now, if I diagnose that particular isotope and that chemical is going and sitting in that tumor, can I use something else so that whatever medicine I'm going is going and sitting there only? There is a new medicine branch is emerging, what is called a theranostics. What is theranostics? It is the diagnostics. I'm using the same information for therapy. This is a huge branch emerging now with the advent of PET technology. What is it going to do? For a PET scan, I'm using the isotope which is low energy. It will not cause any damage to patient at all. No radiation hazard. But when we want to treat the cancer, we use a high energy isotope because it has to kill the cancer cell. This diagnostic isotope will not kill the cancer, it will only identify. We change out that diagnostic isotope and put a therapeutic isotope. Different isotopes are there nowadays called lutetium, actinium, terbium. So many things are coming. There is such a huge interest in all the pharmaceutical companies now in this field. Why? Because we have precisely diagnosed it, and that we are using another isotope which will go and sit there only in the problematic area and gives radiation there, very high dose radiation, without affecting a next normal cell.
What is an isotope?
Isotope is a material, okay, or you can say an element which emits radiation. Okay. So that radiation can be used for diagnosis, also for therapy.
Okay.
When we want to go for therapy, there are isotopes which emit certain beta radiation or alpha radiation that is very damaging to all the cells.
Okay.
But we don't
healthy
want
and sick cells.
Yes.
Okay.
Healthy and all.
Yeah.
But I am making them go to only a cancer cell, not making to go to a normal cell.
Okay.
I am precisely guiding. Why? Because of these specialized molecules which our scientists are developing.
Okay.
So you tag that particular chemical which is used by that cancer cell for some of its function, or it may be its food in simple term. Whereas I have attached something like a poison for that. It will take up. It goes there, gives a radiation, such a high radiation that cancer cell will die. The next normal cell will not get any radiation. Okay. So this is what is called as theranostics. Diagnostic, use it for therapy. It is the theranostics that we are going to start. In Kenya, we are going to start.
The same technology that can be used to destroy cancer cells is the same technology that is used to treat cancer when then found. Through the radiation.
Yes.
Now, so just from what you're saying, that's coming to Kenya soon.
Yes.
But the diagnostic part of it already here.
Yes.
Being launched today?
Yeah, being launched today. We are very excited. We will be launching our PET CT scanner. We scanned our first patient on 4th of February, but We are launching it today. We are very excited. We are looking forward to that. And we are hoping we'll reach a lot of Kenyans, and not only the Kenyans, even beyond the borders. We'll get to see more patients. We'll get to reach more doctors, and they'll send their referrals here because we have a state-of-the-art technology which is going to cut through a lot of oncologic cases, and it has the power of changing people's lives. And like you asked earlier, which he answered, it also complements in like if there's a cancer which was like newly diagnosed, instead of going through all those tests they had to go through prior, you can go through all these tests and maybe you'll miss something, and by the treatment you're given at that point you'll get to miss something and maybe the cancer will advance. So when you come in for this PET scan and we just do it and it's newly diagnosed, we'll catch the cancer at the very early stages, and this will make it super easy for the patient, and we'll treat them and they'll have a higher probability of
That's interesting
healing.
though, because by the time somebody does, before they get a first diagnosis, the amount of money that folks are spending on tests is in the hundreds of thousands of shillings. So we're saying that essentially this will be cut down, and you're getting one answer one time, and then the decision can be made about what treatment you're going to get thereafter.
In fact, what I have started telling, I am seeing a lot of Kenyan patients in my center. A lot of them come for a PET scan, a lot of them come for theranostics. Now I told, don't come here. Okay. Most of the patients, I told them no need to come for the scan here. It has already started there in Kenya. You get it done. They are very super happy. Very happy. So it is easier. And anyway, now technology is there. We can always converse over the phone, and we can tell, and our specialists are there. And now at a push of button with the phone technology and all, we can talk, discuss. We have what is called as multidisciplinary tumor board. They are a tumor board. Only one doctor cannot take a decision today. Every patient needs multidisciplinary approach. I may be saying in my specialty only like this, but you have to always see like this. The another specialty may have another better feature. So this is what is called as multidisciplinary approach. So most of the cancer centers now have it. Okay. So even though we are sitting there, so we can always discuss over the phone and tell, okay, this is the finding, this is it, this is my opinion, and collectively they come to what is best for that patient at that particular clinical scenario.
Right. What is your website, social media, etc., so that people can be able to reach you?
So in all social media platforms, we are on TikTok, we are on Instagram, we are on Facebook. All goes at HCGCCK. You'll find us there. HCGCCK.
Okay.
Yeah.
HCGCCK.
Yes.
Thank you very much. And I think that when we look at how lives can be changed and we look at technology, this is what we're talking about in terms of what can be done. It is a big issue, and there is a lot of pressure on the shoulders of those who are unwell and their families and medical care professionals as well. Thank you for being here this morning. Dr. K.G. Kalur is the Director of Molecular Imaging, and Diane Murioki, a nuclear medicine technologist with Healthcare Global Enterprises, have been here for a Healthy Friday conversation this morning. Thank you for doing that.
Thank you. Thanks
for having
for
us.
me hearing it.
Asante Sana. Good morning, 8 a.m.